Welcome back to Journals Beyond Horizons. Thomas thought he had everything figured out. 68-year-old American retiree moved to Makati in 2022 with his retirement savings and a comprehensive health insurance policy that cost him 42,000 pesos annually. The insurance agent assured him it was premium coverage that would protect him in any medical emergency. 2 years into living his dream retirement, daily swims at the condo pool, weekend trips to Tagaytay, regular dinners with his expat friends. Thomas started feeling unusual chest pressure during his morning walk. Within an hour, he was in the emergency room at a major private hospital in BGC. The diagnosis came quickly: blocked coronary artery requiring immediate intervention. The cardiologist recommended emergency angioplasty, a procedure that would save his life, but cost approximately 680,000 Philippine pesos. Thomas wasn't worried. He had insurance, premium insurance, the kind that's supposed to cover exactly this type of catastrophic emergency. The hospital admission staff called his insurance company, and that's when Thomas's retirement dream started collapsing. The insurance company requested his complete medical history. They wanted documentation from his doctor back in California. They needed pre-authorization for the procedure. They required proof that this wasn't related to any pre-existing condition. Meanwhile, Thomas was sitting in the emergency room, chest pain intensifying, while bureaucrats thousands of miles away, in an air-conditioned office, decided whether his life was worth covering. After 6 hours of back and forth between the hospital and insurance company, the answer came back: claim denied. The insurance company found a notation in Thomas's medical records from 4 years earlier. His doctor had mentioned borderline elevated cholesterol during a routine physical. That single notation, that one phrase buried in pages of medical history, was enough for the insurance company to classify his heart condition as pre-existing and deny coverage completely. The hospital presented Thomas with two options: pay a 300,000 peso deposit immediately to proceed with the life-saving surgery, or sign a discharge form acknowledging he was leaving against medical advice. Thomas didn't have 300,000 pesos in accessible cash. His money was in time deposits, in investments, in assets that couldn't be liquidated in an emergency. He'd spent 42,000 pesos on insurance specifically to avoid this exact situation. What happened next is what's happening to expats across the Philippines every single week. And if you're planning to retire here, or if you're already living here, what I'm about to show you could be the difference between keeping your life savings and losing everything. Because Thomas's story isn't unique. The insurance policy that failed him is still being sold to expats right now. The hospitals that demanded cash deposits before saving his life are the same hospitals you'll be taken to in an emergency. And the insurance companies that denied his claim are the same companies your visa agent might be recommending to you today. Over the next 35 minutes, I'm going to expose the systematic healthcare trap that's destroying expat retirements across the Philippines. I'll show you which insurance companies have the worst denial records, which hospitals hold patients hostage for unpaid bills, and most importantly, how to actually protect yourself in a system designed to extract maximum money from you at your most vulnerable moment. This isn't speculation. This is based on documented cases, expat forum testimonials, legal aid organization data, and interviews with people who've been through this nightmare firsthand. If you're currently living in the Philippines or planning to move here, what you're about to learn could literally save your financial life. Let me start by explaining how the Philippine health insurance system actually works, because understanding this is crucial to protecting yourself. There are essentially three types of health insurance available to expats in the Philippines: international health insurance from global companies, local Philippine insurance companies, and PhilHealth, the government insurance program. Most expats arrive in the Philippines with one of two mindsets. Either they have international insurance from a major global provider that costs anywhere from $3,000 to $6,000 annually, or they're told by their visa agent that they need to purchase local Philippine insurance to satisfy visa requirements. Here's where the trap begins. For visa purposes, particularly the SRRV retirement visa and certain other long-term visas, you're required to show proof of health insurance. The minimum coverage requirements are substantial, typically around 400,000 pesos for inpatient care and 40,000 pesos for outpatient care. For the premium long-term visas, you might need coverage showing up to 2 million pesos or more. On paper, this sounds protective. The government wants to ensure foreigners can pay their medical bills and won't become financial burdens on the healthcare system. But in practice, this requirement has created an entire industry of what I can only describe as compliance insurance, policies designed primarily to satisfy paperwork requirements rather than actually protect you when you need medical care. Let me introduce you to PhilHealth first, because this is something every expat should understand. PhilHealth is the Philippine government's national health insurance program, As a foreigner living in the Philippines, you can enroll in PhilHealth for approximately 17,500 pesos per year. That's roughly $300. Now here's what PhilHealth actually covers. On average, about 20% of your hospital bill. That percentage is based on a complex formula involving your diagnosis, which hospital you're admitted to, and which region of the Philippines you're in. But the rough average works out to around 20%. Is PhilHealth worth having? Absolutely. For 17,500 pesos annually, getting 20% of a major hospital bill covered is significant. If you're facing a 1 million peso surgery, PhilHealth covering 200,000 pesos could be the difference between financial survival and bankruptcy. But here's what you need to understand. PhilHealth alone is not sufficient protection. It's a supplement, not a solution. You need additional coverage. This is where local Philippine insurance companies enter the picture. The most commonly mentioned company among expats is Pacific Cross. There are others including AXA and Alliance. Pacific Cross is popular because they offer what's called no cash outlay plans, meaning when you're admitted to a hospital, the hospital bills Pacific Cross directly rather than requiring you to pay up front and seek reimbursement later. This sounds ideal, and for some people it works exactly as intended. But there are critical factors that determine whether your insurance will actually function when you need it, and most expats discover these factors only when they're already in crisis. Factor number 1, your insurance agent. This might sound strange. Why would the agent matter once you have the policy? Because in the Philippine healthcare system, the agent is your advocate with the insurance company. When you're admitted to a hospital in an emergency, someone needs to contact the insurance company immediately to authorize coverage. If the hospital admission staff calls the general customer service number, your claim can get delayed by hours or even days while it works through bureaucratic channels. A competent agent who knows your policy, knows your medical history, and has direct relationships with the insurance company's authorization department can get approval in minutes rather than hours. A bad agent or no agent means you're navigating the system alone while you're literally in a medical emergency. I've heard cases where the exact same insurance policy with the exact same company produced completely different results based solely on who the agent was. One expat needed emergency surgery, his agent got authorization within 2 hours, and the surgery proceeded without any upfront payment. Another expat with the identical policy and a different agent was told by the hospital that insurance wouldn't cover it, and he needed to pay 350,000 pesos out of pocket before they'd operate. The difference? The first agent knew exactly who to call, what information to provide, and how to expedite authorization. The second agent simply submitted paperwork through standard channels and waited. This creates a massive problem because most expats choose their insurance based on price and coverage amounts. They don't research the agent, they don't interview multiple agents, they don't verify that their agent is responsive, competent, and experienced with emergency authorizations. Factor number 2, pre-existing conditions. This is where the majority of insurance denials occur, and it's far more complex than most people realize. You might think a pre-existing condition is something you currently have and are actively treating. That's true, but insurance companies define it much more broadly. A pre-existing condition can include anything that was diagnosed, treated, or even noted in your medical records before you purchased the policy, even if it was completely resolved years ago. Remember Thomas from my opening story? His claim was denied because of a notation about borderline elevated cholesterol from 4 years before he purchased his Philippine insurance. He wasn't taking medication for it. It hadn't required any treatment. It was simply mentioned in his medical records. But that was enough for the insurance company to classify his heart attack as related to a pre-existing condition and deny coverage. This happens constantly. An expat develops a medical emergency. The insurance company requests medical records from back home. They find any notation, diabetes, mentioned 5 years ago, high blood pressure from 10 years ago, a minor heart irregularity detected on a routine EKG, and they use it to deny the claim. The policy documents are written in deliberately vague language about pre-existing conditions. They'll say something like, conditions that existed prior to policy inception may not be covered, without clearly defining what constitutes a condition existing. Does borderline cholesterol that was never treated constitute an existing condition? According to the insurance company's interpretation when they want to deny a claim, yes. Factor number 3, waiting periods and exclusions. Most Philippine insurance policies have waiting periods before certain coverages become active. It might be 30 days for general conditions, 90 days for specific procedures, or even longer for conditions they classify as high risk. If you purchase insurance and 3 weeks later need emergency surgery, you might discover that your policy's waiting period hasn't elapsed yet and you have no coverage. This creates a terrifying catch-22. You can't get insurance coverage immediately when you arrive in the Philippines. but you also can't risk going without insurance while you wait for the waiting period to expire. The exclusions are equally problematic. Mental health coverage is typically excluded or severely limited. Dental is excluded unless it's related to an accident. Certain hospitals might not be in network. Emergency medical evacuation might not be covered. The list of exclusions can be longer than the list of what's actually covered. Factor number 4, age-based premium increases and coverage terminations. This is perhaps the most devastating aspect of Philippine health insurance for retirees. Let's say you're 62 years old when you move to the Philippines and purchase insurance. Your annual premium might be 35,000 pesos. That seems manageable, but insurance companies in the Philippines typically increase premiums significantly every few years based on your age. By 65, that premium might jump to 55,000 pesos. By 68, it could be 75,000 pesos. By 70, you might be looking at 100,000 pesos or more annually. These aren't small incremental increases. These are dramatic jumps that can quickly make insurance unaffordable on a fixed retirement income. And once you can no longer afford the premiums, you're faced with the nightmare scenario of being in your 70s in a foreign country with no health insurance coverage. Even worse, many policies have age caps, where coverage simply terminates regardless of your willingness to pay. Some policies won't cover anyone over 75, others set the cap at 80. This means you could pay premiums faithfully for years, then reach an age where the insurance company simply cancels your policy and refuses to renew it. Now you're in your late 70s, living in the Philippines, with no insurance coverage and probably multiple health conditions that make obtaining new insurance impossible. This is the situation thousands of expats are facing right now across the Philippines. Factor number 5, the bad insurance companies. I need to be careful here because I'm not going to name specific companies and make defamatory claims without absolute proof. But what I can tell you is this: there is a tier of insurance companies operating in the Philippines that have earned reputations in expat communities for denying claims systematically, creating bureaucratic obstacles to payouts, and essentially collecting premiums while avoiding actual coverage. These companies specifically target foreigners who need insurance for visa compliance. They offer policies at attractive prices that meet the visa requirements on paper. Expats purchase them, satisfy their visa documentation, and assume they are protected. Then when a medical emergency occurs, the claim denials begin. The policy had hidden exclusions. The paperwork wasn't submitted correctly. The treatment wasn't pre-authorized. The hospital wasn't in network. There's always a reason why they won't pay. Expat forums and Facebook groups are filled with warnings about specific companies. The problem is, these same companies often have relationships with visa agents who earn commissions for selling their policies. So the very agent who's helping you obtain your visa might be recommending insurance that will fail you in an emergency. Not because the agent is malicious, but because they're earning a commission and haven't personally experienced how these companies handle claims. This is why research is absolutely critical. Before purchasing any Philippine health insurance, you need to spend time in expat communities asking about real experiences. Not just, does this company exist and is it legitimate? But has anyone actually had a major claim paid by this company and what was that process like? The difference between good insurance and bad insurance in the Philippines often isn't visible until you're in a hospital bed needing emergency treatment. By then it's too late to change policies or make different decisions. Now let's talk about what actually happens when you end up in a Philippine hospital, because this is where theory meets reality in the most brutal way possible. Philippine private hospitals operate on what I can only describe as a cash-first model. This is fundamentally different from how hospitals work in many Western countries, where treatment happens first and billing gets sorted out later. In the Philippines, the sequence is verify ability to pay, then provide treatment. Not provide treatment while verifying ability to pay. The verification comes first. When you arrive at a private hospital emergency room in the Philippines, let's say Makati Medical Center, St. Luke's, Asian Hospital, any of the major private facilities, the admissions process begins immediately. While medical staff are assessing your condition, administrative staff are assessing your financial situation. They're going to ask for your insurance information. If you have Philippine insurance with a no cash outlay agreement and a competent agent who can be reached immediately, the process can go smoothly. The hospital contacts the insurance company, gets authorization, and treatment proceeds. But if there's any complication, the insurance company can't be reached immediately. They need additional documentation. They want to review your medical history. Your policy has limitations. The hospital is going to request a deposit. These deposits are substantial. For a serious emergency requiring hospitalization, you're typically looking at anywhere from 100,000 to 300,000 pesos as an initial deposit. That's roughly 1,800 to 5,400 US dollars that you need available immediately. Most expats don't keep that much cash readily accessible. Your money might be in time deposits that require notice to withdraw. It might be in investments. It might be in your home country requiring international transfers that take days to process. But the hospital needs payment now, before they'll proceed with treatment beyond initial stabilization. This creates absolutely terrifying situations. You're having a medical emergency, you need surgery or intensive care, but you're simultaneously trying to figure out how to access 200,000 pesos within the next few hours. You're calling your bank, you're trying to break time deposits early and accepting the penalties. You're asking family members to wire money internationally. You're doing all of this while you're in pain, frightened, and medically vulnerable. And here's something most people don't know until they experience it. Philippine private hospitals have legal authority to hold patients for unpaid bills. This isn't a rumor or an urban legend. This is actual standard practice. If you're admitted to a hospital, receive treatment, and cannot pay your bill in full, the hospital can refuse to discharge you. They can hold your medical records. They can retain your passport if it was surrendered during admission. You cannot legally leave the hospital until the bill is settled. I've heard multiple accounts of expats being held for days or even weeks while they frantically tried to arrange payment. Some had to take out loans against their Philippine bank accounts. Others had family members mortgage property back home to wire money. Some had to sell their condos at massive losses in fire sales just to get out of the hospital. The stress of this situation while you're recovering from surgery or serious illness is beyond description. You're medically vulnerable, financially desperate, trapped in a foreign country's hospital, and watching your bills accumulate by thousands of pesos per day. Now, hospitals will tell you this policy exists to prevent foreigners from running up massive bills and then fleeing the country. And there is some legitimacy to that concern. Unpaid medical bills from foreigners are a real issue in the Philippines. But the way this policy gets applied creates situations where seriously ill expats are essentially held for ransom. Let me tell you about Margaret, a 71-year-old British woman who had a stroke while living in Cebu. She was rushed to a private hospital, received excellent emergency care, and spent 8 days in the hospital recovering. Her total bill came to 456,000 pesos. Margaret had Philippine insurance, but her policy had exclusions related to neurological conditions with less than 90 days of coverage. She'd only had the policy for 6 weeks when she had the stroke. The insurance company denied the entire claim. Margaret didn't have 456,000 pesos in accessible cash. The hospital wouldn't discharge her. She called her children back in the UK. They tried to wire money, but international transfers were taking 3 to 5 business days to process. Meanwhile, Margaret was accumulating charges of 15,000 to 20,000 pesos per day for continued hospitalization that was medically unnecessary. She could have been recovering at home, but the hospital wouldn't release her until payment was received. By the time her children's wire transfer finally arrived 9 days later, her bill had grown to 638,000 pesos. Margaret had to use virtually her entire emergency fund to pay it. Her retirement savings were decimated. She ended up returning to the UK 6 months later because she could no longer afford to live in the Philippines. Stories like Margaret's are not isolated incidents. This is happening regularly across the Philippines. Now, I need to be fair here. Not all Philippine hospitals are predatory. Many are genuinely trying to provide good care while also protecting themselves financially from unpaid bills. The doctors and nurses are often excellent, compassionate professionals who hate seeing patients trapped in these situations. But the system itself creates these outcomes. The combination of cash-first policies, insurance companies that deny claims, and legal authority to hold patients creates a perfect storm that destroys expat finances. There's also a significant disparity between how Philippine citizens and foreigners are treated in this system. Filipino patients often have extended family networks that can pool resources to pay medical bills. They understand the system and know how to navigate it. They might have connections or relationships that help expedite payment arrangements. Foreigners have none of these advantages. We're isolated, unfamiliar with the system, and often don't speak Tagalog well enough to negotiate effectively with hospital administration. We're at a massive disadvantage when these financial crises occur. The other crucial factor is the huge gap between private hospitals in major cities versus public hospitals or hospitals in provincial areas. The private hospitals I've been discussing, Makati Medical, St. Luke's, Asian Hospital, the Chonghua Hospitals, Cebu Doctors, these are genuinely good facilities with modern equipment and well-trained staff. If you're going to have a medical emergency in the Philippines, you want to be in one of these hospitals in Metro Manila, Cebu or Davao. But if you're living in a provincial area far from major cities, your options become dramatically more limited. Public hospitals in the Philippines are severely understaffed, under-equipped and overwhelmed. The quality of care drops significantly. I've heard accounts of provincial hospitals using cardboard as splints for broken bones, because they don't have enough proper medical supplies, of surgeries being delayed for days because the hospital doesn't have the necessary equipment or specialists, of patients lying on gurneys in hallways because there aren't enough beds. This is a critical consideration if you're thinking about retiring to a cheaper provincial area in the Philippines. Yes, your cost of living might be lower, but your access to quality healthcare will also be dramatically reduced. If you have a heart attack in a remote area, you might be hours away from a hospital capable of treating you properly. Those hours could mean the difference between life and death. Many expats make location decisions based purely on cost of living without adequately considering healthcare access. Then, when a medical emergency strikes, they discover too late that they've placed themselves far from the medical infrastructure they might need to survive. Here's something that doesn't get discussed nearly enough: the connection between your medical situation and your visa status in the Philippines. Most expats are living here on retirement visas that have specific financial requirements. For the SRRV, for example, you need to maintain a certain deposit amount in a Philippine bank, typically $10,000 to $20,000 depending on your age and which SRRV option you've chosen. Other visa types require you to demonstrate minimum monthly income or maintain certain bank balances. Now imagine this scenario. You have a major medical emergency, your insurance denies the claim or only partially covers it. You're forced to pay hundreds of thousands of pesos out of pocket. Where does that money come from? From your Philippine bank account, from your emergency fund, from the very savings that are required to maintain your visa status. After paying a 600,000 peso hospital bill, you might find yourself below the financial threshold required for your visa. Suddenly, you're not just recovering from a medical emergency, you're facing potential visa problems when it comes time to renew. Philippine immigration requires you to demonstrate ongoing financial capability to support yourself in the country. If your bank balance has dropped significantly because of medical bills, you might not meet the requirements anymore. This could result in visa denial or being forced to leave the country. So you end up in this nightmarish catch-22, pay your medical bills and lose your visa status, or don't pay your medical bills and face legal problems with the hospital and potentially immigration authorities. There's another layer to this that's even more insidious. Philippine banks have been increasingly scrutinizing foreigner accounts under anti-money laundering regulations. Large sudden withdrawals to pay medical bills can trigger fraud alerts that result in your account being frozen. I've read multiple accounts of expats whose bank accounts were frozen because family members wired money from abroad to help with medical bills. The bank's automated systems flagged it as suspicious activity. The account got frozen pending investigation, and now the expat can't access their money to pay the hospital bill that's accumulating daily charges. You're stuck in a bureaucratic nightmare. You can't pay the hospital because your account is frozen. The bank won't unfreeze your account until they complete their investigation, which might take weeks. The hospital won't discharge you until you pay. Your medical condition is deteriorating from stress. And all of this is happening because you tried to access your own money to pay for emergency medical care. Another issue rarely discussed: unpaid medical bills can affect your ability to leave the Philippines or return in the future. When you leave the Philippines through the airport, immigration has access to databases that include unpaid debts, including medical bills. If you have an outstanding hospital balance, there have been documented cases of immigration preventing departure until the debt is settled. Even if you manage to leave with unpaid medical debt, that information stays in the system. Try to return to the Philippines in the future and immigration might deny you entry based on your previous unpaid bills. Your debt history in the Philippines can follow you indefinitely. This creates horrible situations where expats are trapped. They can't afford to pay their medical bills and also can't afford to leave the country or risk returning in the future. Let me tell you about David's situation. David is a 64-year-old Australian who lived in Manila for 6 years. He had a serious accident requiring multiple surgeries. His insurance covered about 60% of the costs, but he was still responsible for 420,000 pesos out of pocket. David paid what he could from his savings, but it wiped out his emergency fund. When his SRRV came up for renewal, he no longer met the financial requirements because his bank balance had dropped below the threshold after paying medical bills. Immigration denied his visa renewal. David was given 60 days to leave the Philippines, but he still hadn't fully recovered from his surgeries. He was medically cleared to travel, but he was in pain, on medications, needing follow-up care. And he had to somehow relocate back to Australia within 60 days while dealing with all of this. David ended up having to sell his condo in a rush sale, taking a 30% loss because he didn't have time to wait for a better offer. He had to ship or abandon most of his belongings. He had to leave friends and a life he'd built over 6 years, all because a medical emergency depleted his savings below the visa requirement threshold. This is why I keep emphasizing that healthcare in the Philippines isn't just about medical care quality. It's about the entire financial and legal system that surrounds medical care and how that system can destroy one's entire life in the Philippines if something goes wrong. So after exposing all these problems, you're probably thinking, is there any way to actually protect myself? The answer is yes, but it requires strategic planning, realistic expectations, and understanding that there's no perfect solution, only better and worse approaches. Let me start with what successful long-term expats actually do differently when it comes to healthcare protection. Strategy 1. Layered insurance approach. The expats who have successfully navigated the Philippine healthcare system for years don't rely on a single insurance policy. They use a layered approach combining multiple types of coverage. Layer 1 is PhilHealth. Yes, it only covers about 20% of hospital bills on average, but for 17,500 pesos per year, that 20% can be significant. On a 1 million peso hospital bill, PhilHealth, covering 200,000 pesos means you're using 800,000 pesos less of your other coverage or personal funds. That could be the difference between financial survival and bankruptcy. Every expat living in the Philippines should enroll in PhilHealth. It's affordable, it's government-backed, so it's not going to suddenly disappear or deny coverage arbitrarily, and it provides a baseline level of protection. Layer 2 is selecting the right local or international insurance. If you're going with a Philippine company like Pacific Cross, the key factors are: verify they actually have no cash outlay agreements with major hospitals, confirm which hospitals are in their network, and most critically, find a competent, responsive agent before you purchase the policy. Here's how to evaluate an agent. Don't just accept whoever the insurance company assigns you or whoever your visa agent recommends. Interview multiple agents. Ask them specific questions about their experience handling emergency authorizations. Ask for references from other expats they've worked with. Test their responsiveness. If they take 3 days to return your email inquiry, they're not going to be helpful when you're in an emergency room. A good agent will proactively explain the claims process, give you their personal contact numbers, including mobile, and tell you exactly what to do if you're admitted to a hospital unexpectedly. They'll walk you through scenarios. What happens if you're admitted on a weekend? What happens if you're traveling in another region of the Philippines? What happens if you're unconscious and can't authorize the claim yourself? Layer 3 is maintaining substantial emergency cash reserves. I know this contradicts the whole point of having insurance, but in the Philippine system, you need liquidity. Keep a minimum of 200,000 to 300,000 pesos in immediately accessible savings, not in time deposits that take days to break, not in investments, not in your home country. Liquid cash in a Philippine bank account that you can access within hours. This is your emergency bridge fund for situations where insurance authorization is delayed, where you need to pay a deposit before treatment, or where complications arise that require immediate payment. Think of it as self-insurance supplementing your actual insurance. Strategy 2. Choosing the right location. This might sound obvious, but location decisions need to factor in healthcare access far more than most expats consider. If you're serious about living in the Philippines long-term, and you're over 60, you need to be within reasonable proximity to quality healthcare. That means Metro Manila, Cebu City, Davao, or possibly Iloilo or Bacolod. Not 3 hours into the provinces where the nearest competent hospital requires a long, potentially dangerous transport in an emergency. Yes, provincial living is cheaper. Yes, it might be more peaceful and less congested. But if you have a heart attack in a remote area, the time it takes to get you to a hospital capable of treating you could mean the difference between survival and death. Cost of living savings don't matter if you're dead. Successful expats consider the medical access radius when choosing where to live. They want to be within 30 minutes of a major private hospital. They verify what emergency transport options exist in their area. They know which hospitals their insurance covers and how far away each one is. Strategy 3. Medication planning. Before you move to the Philippines, research every medication you take or might need in the future. The Mercury Drug website has a searchable database. You can search by brand name or generic name to verify availability. If a medication you need isn't available in the Philippines, you have 3 options. Switch to an available alternative before you move, work with your doctor back home to find substitutes, bring large supplies with you if legally permitted, or maintain the ability to order medications from your home country. Don't arrive in the Philippines and then discover your critical medication isn't available. By then you're trapped in a situation where you either go without necessary medication, or you have to make expensive, complicated arrangements to source it internationally. Many expats maintain relationships with doctors and pharmacies back home specifically so they can order medications that aren't readily available in the Philippines. This requires planning and ongoing management, but it's essential if you depend on medications that the Philippine pharmaceutical market doesn't stock regularly. Strategy 4. Doctor and hospital research before you need them. Don't wait until you're having a medical emergency to figure out which hospitals are good, which doctors are competent, and which facilities your insurance actually covers. When you first arrive in the Philippines or move to a new city, spend time visiting hospitals. Not when you're sick, just walk in during normal hours and talk to the admissions department. Ask about their policies for foreign patients, verify they accept your insurance, ask about deposit requirements, get a sense of the facility quality and staff responsiveness. Research doctors in specialties relevant to your health conditions or age-related concerns. If you have diabetes, identify good endocrinologists. If you have heart disease history, find reputable cardiologists. Use online resources, expat community recommendations, and check credentials. Many Philippine doctors trained internationally or in top Philippine medical schools. The quality of physicians can be excellent, but you need to do the research to identify the good ones and establish relationships before you're in crisis. Some expats even schedule routine checkups or consultations when they don't urgently need them, just to establish a relationship with doctors and get into the hospital system. This way, if an emergency occurs, you're not a complete stranger to the medical community you'll be depending on. Strategy 5. Understanding real costs. Let me give you realistic cost expectations so you can plan appropriately. These are approximate costs at major private hospitals in Metro Manila. For common procedures, routine doctor consultation, 600 to 1,200 pesos. Basic blood work panel, 2,000 to 4,000 pesos. Chest x-ray, 800 to 1,500 pesos. CT scan, 8,000 to 15,000 pesos. MRI, 12,000 to 25,000 pesos. Emergency room visit without admission, 5,000 to 15,000 pesos. One-day hospital stay, 15,000 to 40,000 pesos. Depending on room type, appendectomy with 2 to 3 day stay, 150,000 to 300,000 pesos. Gallbladder surgery, 180,000 to 350,000 pesos. Heart bypass surgery, 800,000 to 1.5 million pesos. Hip replacement, 500,000 to 900,000 pesos. Cancer treatment varies dramatically. 500,000 to 3 million pesos depending on type and duration. These are ballpark figures and can vary significantly based on hospital, specific circumstances, complications, and length of stay. But they give you a sense of the financial exposure you're facing. Outpatient care, routine doctor visits, basic lab work, minor procedures is genuinely affordable in the Philippines. You can manage these costs out of pocket without insurance. It's the catastrophic events, major surgery, extended hospitalizations, cancer treatment that will destroy you financially without adequate coverage and planning. Strategy 6. Embassy limitations. Know what they won't do. This is critical to understand. Your embassy cannot and will not pay your medical bills. I don't care how dire your situation is, how sympathetic the consular officer is, or how much you've paid in taxes over your lifetime. Embassies don't have funds to cover medical expenses. What embassies will do: provide a list of local doctors and hospitals, help you contact family members back home, assist with navigating local bureaucracy, help arrange emergency medical evacuation if you have insurance that covers it, and provide information about how to transfer money internationally. What embassies won't do: pay your bills, guarantee payment to hospitals, provide loans, or negotiate with hospitals on your behalf to reduce charges. You need to understand this clearly. If you end up in a Philippine hospital with massive bills and no way to pay, your embassy is not a solution. They might provide moral support and administrative help, but the financial responsibility is entirely yours. Strategy 7. Long-term planning for aging. Here's something most expats don't think about until it's too late. What happens when you're too old or sick to manage independent living? Skilled nursing facilities, assisted living, and long-term care options exist in the Philippines, but they're far less developed than in Western countries. There are some facilities in Manila and major cities, but options are limited and quality varies dramatically. The facilities that do exist are generally cash pay only. Don't expect insurance to cover long-term care. You'll be paying out of pocket, typically anywhere from 25,000 to 60,000 pesos per month, depending on level of care and facility quality. Many expats plan to age in place in the Philippines with hired caregivers, but this has its own challenges. Finding reliable, trained caregivers is difficult. Turnover is high. Quality of care can be inconsistent, and as your needs become more complex, home care becomes inadequate. Successful long-term expats maintain realistic exit strategies. They keep enough resources to return to their home country if their health deteriorates to the point where Philippine healthcare or care facilities can't adequately meet their needs. They maintain relationships with family back home who could assist with repatriation if necessary. They don't burn all bridges, assuming they'll spend their final years in the Philippines, regardless of health circumstances. Strategy 8. Prevention and health maintenance. The single best protection strategy is staying as healthy as possible for as long as possible. The healthier you are, the less exposure you have to the healthcare system and all its financial traps. Regular exercise, maintaining healthy weight, managing stress, avoiding excessive alcohol, not smoking, all the standard health advice becomes even more critical when you're living in a country where a major health crisis could bankrupt you. Many expats improved their health after moving to the Philippines because of the climate, outdoor lifestyle, and lower stress. Take advantage of this. Swim regularly, walk daily, stay active. The longer you can delay or avoid major health problems, the longer you can sustain your retirement here. What this all means: here's the bottom line: healthcare in the Philippines is a complex, imperfect system that requires active management and realistic expectations. The quality of medical care available at good private hospitals is genuinely decent. Filipino doctors and nurses are often well trained and compassionate. The facilities have modern equipment. You can receive good treatment. But the system surrounding that care, the insurance industry, the payment requirements, the legal structures, the visa complications, creates enormous financial risk for foreign retirees. You can successfully navigate this system, but only if you understand how it actually works, not how you hope it works. Prepare extensively before you need medical care. Maintain adequate insurance with a competent agent. Keep substantial emergency reserves. Choose your location with healthcare access in mind. Research doctors and hospitals proactively. Accept that even with all this preparation, things can still go wrong. The expats who thrive in the Philippines long term are the ones who plan for medical disasters, hope they never happen, but aren't caught unprepared when they do. The expats who fail are the ones who arrive with inadequate insurance, minimal savings, no healthcare research, and the assumption that it won't happen to me, or I'll figure it out when I need to. Medical emergencies don't wait for convenient timing. They don't care if you haven't finished your research or built up your emergency fund. They happen suddenly, unexpectedly, and they expose every gap in your preparation. Thomas, the American I told you about at the beginning of this video, the one who had his insurance claim denied for a heart procedure, what happened to him? He ended up paying the 300,000 peso deposit by breaking multiple time deposits early and accepting the penalties. The hospital performed the angioplasty. He survived, but his total bill came to 680,000 pesos. After PhilHealth covered about 20%, he was still responsible for roughly 550,000 pesos that his insurance refused to pay. Thomas depleted most of his emergency savings to pay that bill. When his SRRV came up for renewal 8 months later, he barely met the financial requirements. He had to transfer additional funds from the UFED just to get his deposit back up to the required amount. He's still living in the Philippines, but his financial buffer is gone. His retirement security has been compromised. One more major medical event, and he'd likely be forced to return to the US. 6 years of building a life here, potentially ended by healthcare costs that insurance should have covered, but didn't. Thomas's story is playing out across the Philippines with hundreds of expats. Some survive it financially, many don't. Some are forced to return home. Others are trapped here, unable to afford leaving, but also unable to afford staying safely. The healthcare trap in the Philippines isn't about the quality of medical care. It's about the intersection of insurance that doesn't actually insure, hospitals that require cash before treatment, visa requirements tied to financial status, and a legal system that allows hospitals to hold patients for unpaid bills. If you're planning to retire in the Philippines, you need to understand this system completely. You need insurance, real insurance with a competent agent, not just compliance insurance to satisfy visa requirements. You need emergency cash reserves. You need to be near quality hospitals. You need to research before you need care. And you need to accept that even with all of this, the system can still fail you, because that's the reality that the retirement blogs and visa agents aren't telling you. In my next video, I'm going to expose the 2025 Philippine tax law changes that are destroying expat finances through legal means. How the Bureau of Internal Revenue is now enforcing worldwide income taxation on foreign retirees, and why your pension or investment income might suddenly face massive Philippine tax bills you never anticipated. If this video opened your eyes to healthcare realities in the Philippines, hit that like button and share it with anyone thinking about retiring here. This information could literally save someone from financial devastation. Subscribe to Journals Beyond Horizons because I'm committed to telling you the truth about expat life in the Philippines. Not the fantasy that's being sold, but the reality you need to prepare for. Drop a comment below. Have you had experiences with Philippine healthcare or insurance? Are you still planning to move here after watching this? What questions do you have that I didn't address? The Philippines can be an incredible place to retire. The people are warm, the culture is rich, the cost of living is low, and the climate is beautiful. But healthcare is the one area where lack of preparation can destroy everything you've built. Know the risks, plan accordingly, protect yourself with knowledge and resources before you need them. Because in the Philippine healthcare system, by the time you discover how it really works, you're already trapped in it. Stay informed, stay protected, and remember, paradise is only paradise if you can afford to survive it. This is Journals Beyond Horizons, bringing you the reality of expat life. See you in the next investigation.